So in terms of gene therapy challenges, I would say that right now one of the big challenges is the fact that the gene therapies are being done in a sort of ex vivo way. So patients are having to be mobilized, their stem cells are having to be collected, and it could take 1 or 2 attempts to do that. And that is quite a labor-intensive and time-consuming and expensive way of doing it. These cells are then being collected and in a laboratory being edited, if you like. What would be really good, it would be to see the new generation where actually ex vivo technology is not needed, perhaps some way of doing it in vivo where you do not have to do the stem cell mobilization. Currently, even if we did do ex vivo, and the stem cell mobilization is still needed, the other thing that we really need to think about is using the kind of very toxic myeloablative conditioning that's happening right now. So busulfan is the only drug that is being used for myeloablative conditioning, which comes with a huge plethora of side effects, which really, as a patient who has a chronic disease, does not need. So there is obviously effect of it on immediate effects such as neutropenia, and risk of veno-occlusive disease immediately afterwards. But there's also long-term side effects such as fertility, which I know that is hugely important in this patient group. So there are lots of things that still need to be done. The other thing, of course, is we need to continue to monitor the kind of side effects that these kind of gene manipulation might potentially lead to. The gene therapies that are currently in use still induce a double-stranded break in the genome, which then has to use kind of the natural defenses to repair the genes. And if we can then avoid using double-stranded breaks, so essentially what I'm trying to say is that more safer genetic technologies really need to be examined.